Good afternoon. My name is Steve Bartlett. I'm the chair, I have the privilege and honor of being the chair of Respectability, an organization that is fighting stigmas and advancing opportunities nationwide. This is a special report to the donors of Respectability that keep us going, keep us inspired, and fund the efforts that we have in this. It's also a special report on our response and meeting the challenges of COVID. So it's timely because we have changed many of our activities to directly help people with disabilities in the COVID crisis. I'm kicking it off for moderating, but then we're gonna have Jennifer Laszlo Mizrahi, who is the president and founder of Respectability, a force in her own right. And then Janet Lebrecht, who is on the board of directors and is a former head of the vocational rehabilitation department for the U.S. government. It's an area. Actually, I had Janet. I hope you know this. I had the jurisdiction over for my subcommittee over the voc rehab. It was my first legislative activity to get it funded and properly sized. Lauren Applebaum, the vice president for communications for Respectability. Martin Koch, the director of California and Jewish leadership for Respectability. Philip Kahn-Pauley, the director of policy and practices for Respectability. And off camera is Eric Asher, who makes all the technology work behind the scenes. So we'll start with the first presentation. So just a reminder to level set, and this is a briefing to our donors who fund the activities. It funds activities that impact 61 million people in the United States with a disability. More to the point with regard to COVID, and I'm going to say this slowly, we hear a lot about people with underlying conditions, that it sort of rolls off the tongue with the various presentations, and it should. But according to the CDC, 90% of the hospital admissions due to COVID-19 are people with underlying conditions. And most of those are persons with disabilities, sometimes lifetime, sometimes recently acquired. But 90% of the people admitted to the hospital with COVID are people with disabilities due to with underlying conditions. So we have pivoted. We're on the front lines of the policy and the media war to set out to protect people with disabilities. Prior to this year, we were doing that. This also protecting people with disabilities with regard to stigma and employment. We found leaders and journalists. We get them the facts and the sources, so they need to change their policy so the policymakers and the public can change what they're doing to help people with disabilities meet this crisis in special ways. We provide solutions, we identify the problems, and then we set out to try to gain the solutions. Now I'm going to turn it over to Janet Lebrecht, whom I said a moment ago. She's on our board of directors. She's a highly respected leader in the disability community, and I'm calling from Texas. Thank you very much. And Janet is calling in from Atlanta, Georgia. Janet, it's all yours.
Yeah, thank you so much, Steve, and also thank you for your support of the vocational rehabilitation program nationally. It really does make a difference and certainly helps. The estimated 1.1 million individuals with disabilities who come through the vocational rehabilitation program annually. And we recognize that also individuals with those underlying conditions that you just mentioned is really important because these individuals are the ones who are most likely to be visiting their doctors frequently, but also needing that additional support from the medical community, particularly in the COVID-19 environment. And we also recognize that in addition to some of the medical conditions that individuals with disabilities that they have, it's also important to note that they continue to struggle during these types of pandemic emergencies with other everyday to-day life activities, such as being able to have food security, for example, or to be able to access medical equipment that is important for them to be able to be sustained independently in their respective home environment. It also has disrupted the individual day-to-day care that individuals with disabilities may be receiving from personal care attendants or home care assistants that may be coming into the home environment. During the month of April, we had 2 teleconference calls so that we could reach out to the disability community to have a better understanding of the impact of COVID-19, not just on them from a medical perspective, but the impact on food security and other issues like transportation, and being able to find out whether or not they needed support and how we could, as Respectabilities organization, be able to really identify some of these key issues and design a strategy to support them during this time. And we had over 70 participants actually on the call, and it was amazing because individuals identified certain types of issues, such as being able to access food delivery services available, particularly if you are a SNAP recipient. There are some inherent issues regarding some of the federal regulations that govern the SNAP program for individuals with disabilities and individuals who are low income. And so we started working on that as a respectability organization and reaching out to the disability community, and we're able to make some significant headway with identifying those states, as well as getting in touch with key personnel in various states to find out how we could help with identifying important solutions around this particular issue, and it has been a successful endeavor. More work to come on that front, but also on a personal note as well. One of my colleagues, Oli Cantos, also has 3 individual children who are triplets and who are all totally blind, and were highlighted on news media outlets regarding his particular story. And 3 of his own children are certainly have been stricken with COVID-19 and the virus itself, and significant enough that individuals, they needed to be hospitalized. And I think that this really does highlight the significant impact, particularly on individuals with disabilities, that it has. Everything from communication, while these individuals, as well as others, are hospitalized, what their personal desires are, who's actually working with them in the hospital, the fact that you have isolation already going on, when that's combined with the fact that these individuals have disabilities. So that these are really, really important issues. And as funders, we really want to highlight, but also we want to thank you for your continued support of respectability, but also for recognizing the value of, an organization and the foundation to really support the ongoing endeavors for the disability community. And with that, I will turn it over to Philip Campoli.
Good afternoon, everyone, and thank you so much for joining us. Thank you so much for supporting our work. And I really want to just show you kind of how we are responding to this current crisis, how we are working very hard to make sure that disability issues, the lives and the voices of people with disabilities are being heard and represented in the media and at the highest levels of our nation's government, and really helping leaders succeed. So as Janet said, as we respond to this crisis, one of the things we started doing was starting to do these community convenings, and we've got some more in other ways where we did that. And one of those consistent issues that we heard about was the fact that people with disabilities were struggling to put food on the table. And I don't know if any of you are aware of this, but roughly 11 million people with disabilities nationwide receive SNAP benefits. That's food stamps. And as the Congress responded to this current crisis, they expanded SNAP. They put a lot more money in it. As more people have been losing their jobs, they become eligible for it. But there's a critical issue there in that is that several years ago, the U.S. Department of Agriculture, which was responsible for that program, developed an online purchasing pilot to allow people with disabilities and others to be able to pay for online groceries. And that was a great program, but it was only in a limited number of states. And as we've responded to this crisis, as we identify the key barrier being the U.S. Department of Agriculture, and making sure that states would reach out to the USDA to expand them and include them in the pilot program, we've been working with others. We've been working with state governments to get more states online to provide this avenue for people to be able to get groceries, put good, healthy, nutritious food on the table instead of having to risk life and limb, potentially exposing them to this deadly virus. And that has been a significant impact. As you can see, initially, there was only a pilot of a limited number of states that actually were part of the purchasing program. And over the course of the last several weeks, working with our state partners, working with other national disability organizations, we've actually been able to push 14 states to apply to USDA. We are pending their applications. We've got a map here for those who are able to view it. And we are working with leaders in the 21 other states that have yet to allow online grocery delivery. But I want to take a step back and really talk very briefly about what we've done as part of the broader stimulus response package. We've been working in partnership and coalition with our allies, working on such critical issues as making sure that the economic impact payment that will be given to people to help kind of cover costs in the short term would not actually harm people with disabilities or throw them off of their benefits. Through our coalition work, we've been able to help ensure that 8.5 million people with disabilities received that stimulus check to the total of about $10.2 billion. Additionally, we've worked very closely with others who are really focused on Social Security issues to really push the IRS to allow people with and without disabilities who wouldn't typically file taxes have an online way of submitting their information so that they could receive that payment. And that, our estimate, has helped 4.3 million people with disabilities. Likewise, we've been from the very beginning of this crisis on the front lines of the issue of medical rationing. One of the things that we did was, as we talked about, we set up kind of a rapid response war room. We have been checking our emails 24/7, and the first press release we did about COVID was about the dangers of medical rationing, and reminding leaders in both the hospital space, the healthcare space, and in state government that they have obligations under the ADA. They have obligations to respect the value in the lives of people with disabilities, just like anyone else. And we've been at the forefront of that issue, and in the last couple weeks, we've actually bumped it up to about 30 states that have commitments to equity of care, and that has been a major help. We've also helped other organizations, because we're all in this together. We've all probably heard, use that phrase or use that email, and we've helped other disability organizations to apply for the Paycheck Protection Program. But critically, that issue of food security has been occupying a lot of our time because it's a way of helping people directly. I don't know if any of you are aware of this, but one estimate showed that about 40% of people with disabilities lived in food insecure households, meaning that there's millions of people. For example, 1 million people with disabilities use SNAP in California, and until earlier this week, they couldn't order online groceries. But in partnership with others, we've been able to make that change. And so I'd like to turn it over to the Director of Respectability in California, Matan Koch, to take it away and talk about this cycle. Thank you.
Thank you, Philip. So as Philip mentioned, we've been collaborating closely with the allies and networks that we've been able to build here in Southern California, and most notably our partners at the Los Angeles Department of Disability, to meet these needs in real time. As Philip mentioned, one of the things that we've been doing for the 1 million Californians or so that receive SNAP is to make sure that they can receive online delivery, which includes not only the policy efforts that Philip mentioned, but making sure that Southern California retailers accept online SNAP, because of course it's a very valuable benefit only if someone can actually use it somewhere. So we're working closely with our allies at the city and the county to expand retailers that accept it within LA County. But we're working on more than SNAP issues. We're also very aware that there are 3 other major issues facing the Los Angeles community. One is that as we move to distance learning and telelearning, there are many people, either because of a combination of lack of screen access and individualized education needs, are not fully being their needs are not fully being met in this teleeducation environment. So we're working together to find collaborative solutions. We're working to make sure that the COVID testing sites, that the shelters, that the food banks, that the infrastructure that is helping Los Angeles through this crisis is accessible to and is incorporating people with disabilities. And most, perhaps just as important, we are working really hard to expand PPE access, that's personal protective equipment, because we understand that the people that are taking care of people with disabilities need to themselves remain healthy, both because they are so valuable to us and because them being appropriately protected protects us. Next slide, please. So as you'll see, essentially, CalFresh went live, that's California's SNAP program, on April 28th, and will be happy to get back to folks later and tell you how that's going, since we have only one day of data right now. Next slide, please. And of course, one of the things that we realize is the pandemic will end, and the world will go to some new normal. It probably won't go back to just what it was before the pandemic. And that the sad reality is that that new normal is likely to be even more challenging for people with disabilities that are looking for jobs, that are looking to live independently, that are looking to contribute their talents to society than it was before the time of COVID, if only because we went from virtually no national employment to a national employment rate higher than any time since the Great Depression. And so we were already working hard to optimize workforce outcomes here in California, and now we've redoubled that effort and added a COVID lens by first taking the employment resource guide that we were beginning to work on to allow folks with disabilities to know what services they could access to get jobs here in California, and reimagining it through a COVID lens, but also to make sure that the employment first task force, we were convening a task force of providers and of policymakers and of decision makers here in California to really modernize and revolutionize our employment practices, a practice called Employment First, gaining traction throughout the country. And we're making sure that that will be ready to go as soon as California reopens. So that is, I believe that's my last slide. And I'm going to turn it over to my colleague, Lauren Applebaum, who's going to tell you about our communication strategy.
Thank you so much, Matan. And thank you everyone for spending a few moments of your time with us. So as Matan was talking about, we're thinking about what's also going to happen post COVID-19. So since we work so closely with folks in the entertainment industry right now, we have been thinking about how do we help people with disabilities who work in this industry succeed once COVID-19 restrictions are lifted. So 26 million people in the US have lost their jobs during this time. And the entertainment industry is a major employment sector in which we already work. Many productions, as you may know, have shut down due to COVID-19. So we're working hard to ensure that people with disabilities have the opportunity to increase their skills during this time so they can have more job opportunities when the industry reopens. Next slide, please. One part of our education is our summer lab, which is now going virtual, which is great because now people who are not in LA, who are in this industry, and whether they're in New York City or elsewhere, are able to be participating. Next slide, please. So all of this, the education and everything that Matan and Philip have kind of been talking about, all go toward one central goal of kind of creating this virtual community and educating not only the press, but also the public and leaders. So how are we doing all of this? We're educating journalists and leaders through targeted emails and curating new lists. And really important to us, with Americans watching an average of 8 hours of on-screen content daily, we are promoting accurate disability inclusive content, whether that's on TV, streaming services, film, elsewhere, on both social media and in our weekly newsletters. If you want to receive those newsletters, please reach out to us and we can make sure you're added to the appropriate newsletter for your interests. We're also working on videos showing real people with disabilities, working in collaboration with members of our board and lab alumni from summer 2019. And then, as was mentioned by Janet at the beginning, we have a series of community gatherings for people of all different types of disabilities. Janet talked about the one that was for people who are blind and low vision, but we also have done ones for folks who use wheelchairs, for example, for women with disabilities, for Californians with disabilities. And why is this so important? Because it gave us the opportunity to really learn what people need outside the Beltway to then know what to bring to the press and to policymakers. I want to point out one website of importance. If you are wanting to learn everything about that we are doing in terms of COVID-19 pandemic and how it affects people with disabilities, there is a single landing page that you can go to at www.respectability.org/COVID-19. on there. Every release we put out will be included, as well as all the resources that have been mentioned during this time, including state and local resources. I'm now going to pass this over to our President and CEO, Jennifer Lazo-Mizrahi.
Well, I want to thank the entire team for speaking, and I want to thank the donors and the partners who are on this conversation with us on Facebook. I just want to say how much a privilege it is to work with Steve Bartlett, our chairman. He is one of the primary sponsors of the Americans with Disabilities Act from 30 years ago that we're still fighting for those rights and opportunities today. The opportunity to work with Janet Lebrecht, who's on the front lines of enabling people with disabilities to have employment and a better future, and the senior management team of Respectability, Philip, Matan, and Lauren. Together, we're working to really listen to the stakeholders, the people with disabilities themselves across the country, so that we can be responsive during this pandemic that is impacting both the economy and the health of so many people. As you heard from Steve at the very beginning, fully 90% of the people who are admitted to the hospitals in America today are people with underlying conditions. Those are our people, people with disabilities. Here you can see the contact information for Respectability key members on staff. Myself, it's Jennifer M. at respectability.org. But all the work that we do is funded by you, people in the public who care, people who really want to make a difference. We're here to fight stigmas and advance opportunities for people with disabilities, but we need your tax-deductible donations. So go to our website, respectability.org/donate, respectability.org, donate, and you can make a tax-deductible contribution today. We want to thank all of our donors, all of our partners, our staff, and our national leadership fellows for all the work they do. I must say it is a privilege to work on these issues on behalf of such an amazing community, the 60 million people with disabilities who live in our country. Thank you so much to everyone for joining us. Have a wonderful day.